If someone asked, "What makes you you?" how would you respond? For most of us, it is that constellation of experiences, memories, hard-won abilities, perhaps an impressive job title. These are the building blocks that fit together to make us who we are. How can we say hello or hug someone without evoking memories of previous greetings and kisses? The way it feels to be you, your hopes, fears, and expectations are all built upon what you've experienced before. And I think this is why dementia scares us so much. If we are what we remember, who would we be if we don't remember? Would we still exist? Would we still love the people we love? Would life still be worth living? We are Patricia, Sutken, and Pauline. We are researchers at Ghent University, and our goal is to develop tools allowing us to diagnose Alzheimer's disease 10 years before the start of the first symptoms. There's a growing consensus that the best way to fight Alzheimer's disease is through prevention rather than treatment. This is not surprising. We don't wait until someone has a heart attack before we start treating a high blood pressure. So why would we wait to treat Alzheimer's disease if we can tackle certain risk factors years before the first symptoms appear? But how can we do this? The brain is responsible for everything we think, feel, and do. For this hard work, our brain needs oxygen and nutrients, which are delivered through blood vessels. To make sure only molecules that are safe can reach the brain, the blood vessels are covered with a very important thin layer called the blood-brain barrier, separating the brain tissue from the blood. The exact cause of dementia is still debated, but we do know that one of the very first brain changes in Alzheimer's disease is a change in the blood supply to the brain and in the permeability of the blood-brain barrier. This filtering layer is no longer able to prevent toxic materials from entering the brain. The blood-brain barrier also prevents the clearance of a sticky protein called amyloid. Amyloid clumps together and accumulates in your brain. At some point, it reaches a tipping point that causes neurofibrillary tangles, neuroinflammation, cell death, and all the symptoms that we classically know of as Alzheimer's. Prior to that tipping point, you're symptom-free. Our research focuses on detecting these changes in healthy middle-aged adults. Because if you are 40 years or older, it is perfectly possible that amyloid plaques are already accumulating in your brain. We can image the blood vessels in the brain with two scanners, a PET scanner and an MRI scanner. A PET scanner requires an injection of radioactive molecules which travel to the brain. The radioactive molecules decay and emit radiation, which is picked up by a special camera to create an image. An MRI scanner, on the other hand, is a relatively new method. The reason why we're so interested in MRI is because we don't need any contrast agents, it doesn't use radiation, and it is cheaper. Using MRI, we can image people's brains as often as we want. This will allow us to follow people over several years and see in which patients the blood vessels and blood-brain barrier changes before dementia is obvious. But what if we can detect dementia early on? Recently, studies have shown that new promising dementia drugs may slow down the accumulation of amyloid plaques in the brain, but only when given early. So it is really important to find the best tools for detecting dementia as early as possible. Think of the amyloid plaques as a gas leak. At the tipping point, the gas leak sets fire to your house. Once your house is gone, nothing will change when you fix the gas leak. You have to fix the gas leak before your house catches fire. If we are able to predict who's at risk for Alzheimer's disease in the future, our treatment strategy will drastically change. The cure for dementia will likely become preventive medicine. We will start changing our lifestyle and start treatment before the amyloid builds up, before the death of our brain cells, and before we develop symptoms. Our research shows that there is hope. Please share this video with your friends, parents and loved ones, and help us to bring dementia out of the shadows.